Good day, everyone. My name is Dawood Haleemah, an intern pharmacist of University of Ilorin Teaching Hospital. I'm going to be presenting on World Diabetes Day. These are my outline. Introduction. 537 million adults around the world are living with diabetes. In 2019, diabetes and kidney disease due to diabetes caused an estimated 2 million deaths. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. World Diabetes Day. The World Diabetes Day was created in 1991 by the International Diabetes Federation and the World Health Organization in response to growing concerns about the escalating health threats posed by diabetes. It is marked every year on 14th November, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. World Diabetes Day is the world's largest diabetes awareness campaign, reaching a global audience of over 1 billion people in more than 160 countries. The International Diabetes Federation. The International Diabetes Federation is an umbrella organization of over 230 national diabetes associations in 170 countries and territories. The Federation has been leading the global diabetes community since 1950. It represents the interests of the growing number of people with diabetes and those at risk. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, and this condition is termed hyperglycemia. Hyperglycemia can cause weight loss, nausea, vomiting, and blood vision, and it may predispose to bacteria or fungal infections. The symptoms may come and go as plasma glucose levels fluctuate. The signs and symptoms of diabetes. The most common symptoms of diabetes mellitus are due to hyperglycemia. An osmotic diuresis caused by glycosuria leads to urinary frequency, polyuria, and polydipsia that may progress to orthostatic hypotension and dehydration. As seen in the picture indicated, other symptoms include blurry vision, dizziness, thirst, polydipsia, fatigue, weight loss. Severe dehydration actually causes these symptoms. The risk factors for diabetes. The risk factors are classified into modifiable and non-modifiable. The modifiable risk factors comprise of the factors that one actually have control over, and these include physical inactivity or exercise, obesity, poor dietary habits, hypertension, smoking. And the non-modifiable risk factors are those factors that one has little or no control over, such as the genetics, family history, race or ethnicity, increasing age, or history of gestational diabetes. Major risk factors for type 2 diabetes include obesity, physical inactivity, and unhealthy diets. The complications of diabetes. Some people with diabetes develop an eye disease called diabetic retinopathy, which can affect their eyesight. Diabetes foot problems are serious and can lead to amputation if untreated. High blood sugar for a period of time can damage blood vessels, which sometimes lead to heart attacks and strokes. Management, the non-pharmacological management of diabetes. Management of diabetes mellitus does not comprise of taking tablets or insulin alone. Healthy lifestyle changes are of equal importance in preventing and controlling the blood sugar. Stress management is also very essential. The pharmacological management of diabetes. Two major agents are used, the insulin and the oral medications. Insulin has been used since 1922 as monotherapy in patients with type 1 diabetes mellitus. Insulin regimen should be tailored to patients' individual needs, desired metabolic control, and age. The oral medications for the pharmacotherapy of diabetes mellitus. There are different classes of drugs used for the treatment of diabetes mellitus. Example of which include the sulfonylureas, the meglitinides, the biguanides, the thiazolidinediones, the alpha-glucose inhibitors. Examples of the sulfonylureas include glimepiride, glipizide, and their mechanism of action is to stimulate phosphate insulin secretion by blocking potassium channels in beta cells. And the major side effects with these drugs are hypoglycemia and weight gain. The meglitinides, example include repaglinide, and they work by stimulating phosphate insulin secretion by blocking potassium channel in beta cells, just like the sulfonylureas, and they have the same side effect as the sulfonylureas. The biguanides, the major example, which is metformin, and it works by decreasing hepatic glucose production, and it increases muscle glucose uptake and utilization. The major side effects are gastrointestinal, such as the nausea, diarrhea, anorexia, lactic acidosis. Example of the thiazolidinediones include the pioglitazone, and they increase insulin sensitivity via the activation of PPAR gamma receptors. And the side effects of them are fluid retention and weight gain. And the last class, alpha-glucosidase inhibitor. Major example, acarbose. They decrease hepatic glucose production and they delay glucose absorption. The side effects of them include flatulence and abdominal bloating. The best administration time for some of these agents. For the glibenclamide and glimepiride, they are best taken with meal or 15 to 30 minutes before meal. For the gliclazide, glipizide, repaglinide, and pioglitazone, they are best taken with meal. And for metformin, they are taken during or immediately after a meal. Acarbose should be swollen whole with liquid before meal or chewed with the first few bites of food. What are the treatment goals and objectives? We want to maintain blood glucose level in the normal or near normal range. Also, to prevent symptoms of hyperglycemia such as polyuria, blood vision, weight loss, and symptoms of hypoglycemia. And also to encourage the patients to accept diabetes with a realistic but positive attitude. And this is essential because diabetes does not have a cure, but it can only be managed. But with a better cooperation between the patient and the health caregivers, it can be managed successfully and avoiding the side effects and complications. Also, we want to provide comprehensive and ongoing education and reevaluate patient understanding and ability to control his or her disease. And this is one of the importance of the World Diabetes Day. Conclusion. Diabetes is a chronic metabolic disease that, if detected late or improperly managed, can lead to serious and life-threatening damage to the heart, blood vessels, eyes, kidneys, and nerves. To help stop the rise in diabetes and to protect tomorrow, education on diabetes must continue to be strengthened. World Diabetes Day is an avenue to educate the world about the disease, prevention, management, and control. These are my references. Thank you.